Hi, everyone. Welcome to another great session. Super excited about this one, stress buster, something we all need, right, Juliette?
Yes.
Juliette Krummick is with us today. She has presented for us numerous times and has been on our podcast and is just a great presenter. I think you'll really enjoy this session. So Dr. Juliette Krummick has worked for Ashford University, which is now UAGC, since 2011, teaching graduate and undergraduate early childhood courses. She currently lives in Central Florida with her family. She graduated from the University of Central Florida with her bachelor's and master's degree in early childhood education. Her doctoral degree is in education with a specialization in organizational leadership from North Central University. Her work experience includes working in a preschool, teaching public elementary students, and adult online learning settings. So Juliette, thank you so much for being here. Next slide, please. This disclaimer just says that UAGC does not warrant any of the information, goods, or services, links, pictures, anything provided in this presentation. And an online degree from UAGC does not lead to immediate teacher licensure. So if you do get a degree from UAGC, you will need to go back to your individual state and make sure that you figure out what the teaching and certification requirements are there. So Juliette, the floor is yours, and thank you for being here.
All right, let's get started. Okay, so according to the National Center of Complementary and Integrative Health 2020, stress is a physical and emotional reaction that people experience as they encounter changes in life. Adults and children encounter different types of stress, and they are affected in different ways. Take a second and think about how stress affects you personally. Do you have physical signs, maybe rash, pimples even? Do you have emotional signs? Crying, getting angry, mad? Do you ever feel overwhelmed or have that fog brain feeling? All right, so let's take a closer look at what stress does look like in children. So stress can look a little different for everyone. I found this great coloring chart by mylemarks.com. Children can color in what happens to their bodies when they are feeling stressed. Different types of stressors can cause different reactions in the body. Making a connection between how they are feeling and what reactions children have will allow them to self-identify when they are feeling that stressful situation. These reactions are physical warning signs to alert the child and adult in their life that something is just not right. Let me give you an example. The child I'm thinking about shows a few different signs. His heart races. You can see that his face will start getting red, and then he starts sweating, which is followed by getting angry, and he yells. Now you think about one child in your life that you have seen looking stressed recently. What was their reaction to that stress? All right, so what happens if that stress continues? So according to the CDC 2021, there are some signs that stress is becoming a problem, or if the child has experienced a very stressful event. When any of the more severe symptoms last longer than a month, directly related to stress, a child could be diagnosed with post-traumatic stress disorder. Here are some of the symptoms to be on the lookout for. The symptoms can range from not sleeping to avoidance. Hopefully, we can support our child before the stress really starts affecting the child's life. All right, so warning signs. Remember that coloring sheet we just looked at? The reactions to stress will give that signal that something is wrong and the child needs help and support from us to help them work through the situation. Think about yourself and stress. What is the main warning sign that you show or feel when in a stressful situation? Now, consider if your basic needs are met. Did you get enough sleep? Did you have something to eat prior to your stressful moment? Let's take a couple seconds to think about your own warning signs, and you can determine if those basic needs for yourself were met or not. Don't forget, we can get hangry too. All right, so first let's look at the circle of control. The Cleveland Metro School District 2022 wants students to focus on what they can control in hopes to lessen the stress or worry that might occur. If ideas are within your control, you can do something about them and strategize to influence those ideas. So taking a look at the control side here in the picture, we can see that a child, or adult for that matter, can control themselves and their ideas. Whereas the ideas outside their control is anything that other people do. Learning about what we can control will help us to limit stress. Let me give you a quick example. The child I was referring to earlier was upset that his sister won an award. His situation was not in his control. He was not part of the selection process or participated in the activity to even be able to win the award. This was completely out of his control, but it still caused him stress. He was upset that he didn't participate in the first place. We were able to discuss how he was not participating in the event, but could plan to participate in future events. This is in his control. He can control his actions by participating later. All right, so according to Van Ark 2018, meeting students' basic needs is essential for deeper learning. Using Maslow's hierarchy of needs, these basic needs make up that bottom base of the pyramid, which is needed to support everything else. Just like in my image, what comes around goes around. We can take steps to help support children's different needs. First up is physical. We can promote our physical well-being by having a good sleep routine, staying physically active during the day, allowing for physical release of that stress. Next, emotional, we can help a child manage stress, show compassion and kindness. Socially, we can create a support system for children. We can simply spend time together and create that environment where they know that they can seek help. Last, supporting that spiritual idea, we can teach children how to meditate or relax. Do some yoga or even journaling. This could be written in words or pictures to express the ideas. All right, things to consider. So we've chatted about warning signs, our circles of our control and out of our control, types of self-care that we can kind of help to try to prevent stress. Now we can look and show children what's in our control, take care of themselves and yourself, and you can set children up for success. Does this look like a familiar situation to you? This child understands what her warning signs are. She understands what was in her control and what was not, and she's getting her self-care needs met. However, there is still the problem. She's upset that John knocked over her building, that she just spent the last 15 minutes building. Now what? What is our next step? There are a few steps that we can go through to help a child that is feeling distress, like in my example. We will go through these individually, but just to give you a heads up on the 4 main ideas that we're going to look at. They include breathing, determine what regulation zone the child is in, select an activity to help using the calming kit, and reflect. So before we dive into too many strategies, let's take a little time for ourselves. So first, we're going to take 3 deep breaths. You're going to use your own knowledge of breathing and think about what you need to do to ensure your breaths are allowing you to become a little calmer and a little more relaxed. All right, start now. All right, so while you were breathing, did you notice how you were feeling? Do you know that your breathing actually changes when you enter a stressful situation? Most people start taking short, shallow breaths, according to Better Health. These short breaths can make your symptoms even worse. According to Better Health 2021, a relaxed breathing pattern seems to calm the nervous system that controls the body involuntary functions. I want you to keep in mind how you just breathe on your own. While I continue, the first step in this breathing sequence is to have the child take longer breaths to get that body back to a normal rhythm and normal balance. This will help for better decision making and will allow a child the opportunity to communicate better, to tell you what's happening. It is suggested by Sampson 2020 that you can purposely practice breathing by breathing in through your nose for 2 seconds and breathing out through your mouth for 4 seconds. Let's try this together. Breathe in your nose for 2 seconds, 1, 2, and then out through your mouth, 1, 2, 3, 4. Just like we just practiced, you will need to practice with children too. This way, when a child is feeling stressed, they will know what you are talking about when you are asking them to breathe. I would recommend breathing with the child. You are the role model, and you're going to role model those breaths and count out loudly, just like I did, so they will know. It is recommended to do this 5 to 10 times. This number would really depend on the child and if they're becoming more calm with each breath. In a less severe situation, you might only need the child to take 3 breaths, when other times events might have created more stress, needing more deep breaths to get more oxygen to the brain to start to calm down. Remember, 2 breaths in, count to 4 breathing out. Now compare this type of breathing to the one you just did yourself at the beginning of this slide. Did you notice a change in how you're feeling? Do you have a sense of calmness? You might also think to yourself that you know a better way to do controlled breathing. For example, there's one method where you breathe in, hold your breath for 2 seconds, blow air out, hold for another 2 seconds. The problem with this type of breathing, according to Royal Children's Hospital in Melbourne, children aged 6 months to 6 years might have breathing holding spells. So this is not recommended to teach young children to hold their breath. So stick to the 2 counts of breathing in and 4 count breath out. All right, next up is determining what self-regulation zone a child is in. Take a look at this chart. Okay, it's free. Yes, I said free. Downloaded from Zones of Regulation. This chart you are seeing and the individual charts that we will look at in just a second are available for downloading. A child can use words to help you know what zone they are in. They can tell you out loud with words or point to the pictures to reveal what zone they're in. These zones will help to reveal the emotion that they are feeling right now. By showing what zone the child is in, they are recognizing that an emotion is occurring. This connection to specific feelings will help the child vocalize more about how they are feeling. We want children to recognize how they're feeling, how their body is responding to that feeling. Eventually, according to the Center of Social and Emotional Foundation for Early Learning, the idea is for the child to be able to know what they are feeling, know the steps to feel a little calmer, and be in control of the situation. Let's take a closer look at those zones. So if you notice, there are some positive and negative emotions in these zones. You can feel stressed by being angry or from being overjoyed. Okay, so here's a great example. My daughter had her birthday. We only had a few relatives over to celebrate, but I could tell that she was entering into that red zone. Her palms were getting sweaty. She just looked overall tense. I told her she needed to take just a little break. We went into her room and breathed together. Then I asked her what she wanted to do. She asked what her options were. We'll talk about the options in just a minute. I gave her some options that I knew would calm her down. Read a book in her room where it's quiet and cool, take a quick shower, and or get a drink. She opted for getting a drink and reading a book. After 5 minutes, she was revitalized and ready to join the party. Later on, she asked why this happened. I explained that she was just overjoyed and it was just a little too much for her body to handle right at that moment. I also told her it was her birthday and she could spend it however she wanted. She was concerned that there was people over her house and I assured her it didn't matter. She needed to take care of herself first. So take a couple of seconds real quick and listen to your own body and determine what zone you're in right now. So right now, I would be in the green zone. Calm, relaxed, focused, and very proud to be sharing some great information with you today. All right, so the Calm Down Kit. This can include anything from snacks to toys of your choosing. There are some components that I have in my own home Calm Down Kit. So the next few slides are like close-up of the components that I have. In my components, I have a ring of the Calm Down activities, squishies, books, snacks, fidget toys, coloring sheet, that zone chart that we just looked at, headphones, music, stuffed animal, and a bucket to hold everything together. All right, check it out. Here's my Calm Down Kit, full of so much fun. So I have different things. I don't even think you can see my ring of activities. I think it was underneath that monster. Yes, I did say monster. We'll go into that in a second. So keep in mind that all of these things are what my personal kids needed and they suggested. It was kind of a group effort. So we'll get into exactly what's on those Calm Down activity ring in just a second. So one of the things I do want to mention is my children like to take a shower. My kids are older, so keep that in mind. It helps them feel fresher and more relaxed, and that warm water does the trick. Now, you can't have kids take showers at school, of course, but maybe they can splash a little water on their face or take the wet washcloth to their face. That cool water can give that sense of real refreshment. A few other activities that are a favorite: snacks, exercising, reading books. Squeezing squishies is always a fun option to get included in there, but let's take a closer look at what's actually in that bucket. All right, so here is my worry monster. I want to tell you just a little more. So check out his mouth. It opens and closes with a zipper. The idea here is to write down your worry or drawing and put it in his mouth, and he gobbles it up. So you no longer have to worry about that idea that you wrote on the piece of paper. The worry monster will eat it, so you no longer have to worry about anything. Cool, right? So we bought this one from Amazon, but 10 years ago, I found a zipper IKEA frog that works just as well. There's a few other options out there on the market, like sharks, where you zipper open their mouths and they can gobble up those worries too. I thought the monster was a good size to hold and kind of cuddle with if necessary. All right, so here are my activity cards. My kids came up with these on their own. We do have 2 dogs, so Doggy Kisses is always a favorite. It helps lighten anybody's mood, but definitely works well with my children. Again, you can kind of see the shower there. And the next one is drawing a picture. We are very good drawers here, and we like to kind of express through art. But again, you can have anything you want on your activity ring that they can pick from, and choices are always good. And like we did, we drew our own. So get creative with that. And be sure to pick activities that are safe and appropriate for your environment and for the kids. My kids are closer to middle school age, so they can, for example, take a shower on their own. I do make sure that if they use this option to go check on them, make sure everything is good to go, washing away those worries. All right, so fidget toys, also a great thing to add in there. Here we have a couple of Rubik's cubes. This is a fidget ball. It's very cool. You push in the little circles. And we have a clicker. And of course, you can add snacks too if you feel that's necessary. Some kids are just hangry and just need a moment to get their energy back from a quick snack. All right, so listening to music. So we're gonna get a little old school here and check out my Walkman and my headphones. I have a cassette with classical music that a child can listen to at any time, and they can start and stop the music as they feel necessary. You can use other types of technology too, but this works really well for me. It's easy to use, and I use rechargeable batteries. All right, inside my kit, I also have a few books. I have a variety and things that are appropriate. Even though my kits are bigger, these still work really well. So these are in my kit. We have Ladybug's Birthday by Mazurger. This is about a ladybug who becomes overwhelmed at her party. The Last Stop on the Market by De La Penta. It's about a child who is patient and takes in what's around him on his bus ride. Mr. Wrinkles by Pierce is a story about an elephant who gets stuck and needs the help of his friends to work together to get him unstuck. Chrysanthemum by Hanks is a story about a girl who doesn't like her name once she's at school until her teacher steps in. We have Splash by Jonas. This is a counting book, but sometimes you need to keep your mind busy and off of what's bothering you to help. And counting seems to be the perfect remedy for my family. All right, so also included is a color sheet of a body shape. If you notice, this one is blank, unlike the one we looked at earlier. I found that my own children were looking at the suggestions instead of explaining what was wrong with them right in the situation. This way, they can color the area that they're feeling, where they're feeling the emotion or the pain or side effect that comes with that stress. This way, they can also kind of explain what's going on. And maybe if you want, you could always go back to this and say, okay, are those symptoms relieved? So you definitely have a couple options there. All right, so here are those zone individual cards that we talked about earlier. Mine are also in my bucket so that my kids can pick which zone they are in. Mine are quite well loved and dirty and covered in random things. It's in play, we always need them, but you can laminate them for a better durability. All right, so we have two squishy toys in my bucket. Here's a foam squishy and a small plush dog that you can squeeze. I think it actually squeaks too. All right, here's my container. I bought this bucket in the spring for $3 at Walmart, but you can use anything. Basket, bucket, box, etc. to hold all your items together. Being able to see the items and the activities in there is kind of helpful for kids too, so they know where to go and what they want to use to help try to calm down. The last step is reflect. So you can make reflection cards and add them to your calm down kit too, or you could just ask questions when the child seems calm after completing an activity or two. The type of question that you ask is totally up to you. I would definitely look at the regulation zones and see what zone has changed. Maybe they've gone from that red zone to maybe a green zone or a blue zone. This will give you a clear indication if their emotion had changed. This reflection can be quick and short, and the child needs to get back to the task at hand. All right, so what about the adults in this situation? What do the adults do? First, as soon as you see a situation occur, be with the child. It is time to step in, acknowledge what's happening, remind the student of the first step. Take a minute to take a few controlled breaths together. Remember, you're the role model. Make your breaths exaggerated so the child will mimic bigger breaths. Have the child pick what zone they're in. Next, have them pick an activity or two to become more calm. Then ask questions to reflect to allow that student to really get into what happened and how they are now. Still not calm? Go through the steps again. Some children might only need to take a few breaths and be fine. Other children might need to go through the steps multiple times. Your job is to stay calm. Each child you work with will be different, and every situation can be different. Having many different options is always a good choice. Watching for those physical attributes will quickly alert you that your child needs support. So make that calm down kit today and be a role model and stay calm. Dr. Shipley?
Yes, sorry, I was trying to come back on. Thank you so much. I'm going to stop the recording now.